What to do after COVID-19 left many young people. Cochino, a 24-year-old white-collar Mumbai-collar woman, had previously had life insurance. There is almost no concept. But the new crown epidemic caused him to change his mind quickly. She said that she bought life insurance without hesitation when she saw people of my age contracting and dying. I don't want to see how my family was raising money after my accident. During the second outbreak of the epidemic in April and May, the new life insurance participation for young people aged 25 to 35 in India was 30% higher than that of the first 3 months of this year. Due to the low per capita income level, India's national life insurance participation rate, in 2019, it was only 2.82%, an increase of 0.67% from the beginning of the 21st century, and it was far below the world average. The current epidemic of COVID-19 has led to a significant increase in people's awareness of the need for financial protection and the current insufficient insurance coverage. Since COVID-19 first hit India about 15 months ago, people under the age of 35 have an increasing demand for products that protect themselves. Although the number of infections in the second wave has declined, there are still many places where the number of infections has increased sharply. This is due to India's slow start in the difficult task of vaccinating its people. The third wave of infection is very likely to happen, but now young Indians are also starting to be vaccinated. According to data released by the Ministry of Health of India, as of June 17th, local time, the number of new deaths from new coronary pneumonia in a single day in India has been increasing. In the past 24 hours, there were 67,208 new confirmed cases, 2,330 new deaths, and a total of 381,903 deaths. The nearby India epidemic has improved on the surface, but many experts are worried about it. According to a report from Reuters on June 15th, local time, the number of new confirmed cases of new coronary pneumonia in a single day in India in recent days, to the lowest level in more than 2 months. Cities such as the Science and Technology Center south of the New Delhi River and Bangalore, the capital of northern India, have begun to lift strict blockade measures. The train station and shopping center are crowded with people. Dr. Vijay, a member of the expert committee of the Karnataka New Crown Epidemic Task Force, believes that it should not be unblocked so early. Unfortunately, people see the government's lifting of the blockade as a declaration of victory. As for Professor Lee or John of the Rajagiri School of Social Sciences in Cochin, in southern India, the current statistics of the Indian government do not reflect the true situation of the epidemic in India. In the data of a virus detection agency during the Great Hum Festival, 1 out of every 4 tests is a fake institution, and the 8 current confirmed numbers are just the tip of the iceberg. The insurance of this BMHS company. If you are unfortunately infected with COVID-19, you only need to collect all the materials and upload them to BMHS app to get compensation. The relevant medical expenses will be compensated based on the health money you bought, including the common cold and more than 300 known diseases. You only need to submit a detailed case evidence report, pay 50% to 80% of the health money in accordance with the compensation regulations, and get 50k 2000k rupees. So what is insurance? Insurance transfers risks. What risks are transferred? Prepare in advance for risks that have not yet occurred. Now that COVID-19 is so serious, hurry up and buy a health insurance for yourself and your family.